Maxwell says we don't have to sing, but we do need to get the exam, or do we? There are a lot of different ideas and a lot of updates and new thinking on prostate cancer screening. Let's talk a little bit about that. Where do we stand in terms of what your profession should tell us to do?
There needs to be a lot of discussion between doctor and patient when it comes to screening for prostate cancer.
Right.
They are actually going away from having the prostate exam, unfortunately, for the gentleman from 2 years ago. So if you're not having any symptoms of an enlarged prostate or prostate cancer, oftentimes they will say you can just have the blood test done and then follow that appropriately depending on what your initial blood test is.
Is that the PSA number that we hear about?
Yes, the PSA, yeah.
And that's the number that you kind of watch on the scale and see where you land?
Exactly.
Now, and so is prostate screening and that element of men's health the most important thing that we should keep an eye on, or what other things should we watch? Because men are men as notorious as the stereotype about not wanting to come in and get checked?
Oh, definitely. There's almost always a wife involved, or a girlfriend, or a sister when a man comes into the clinic. So as far as cancer is concerned, prostate cancer is at the top.
Right.
But even though it's the #1 cancer killer in men, most men who have it don't end up dying from cancer. They die from other causes.
Right.
So heart disease is still the #1 killer for men. So that's really what we should be focusing on when a man comes into the clinic.
So what kind of questions should the man have, or the important person who's pushing the man to go do that? What questions should we have on our list when we come and talk to somebody like you?
Well, you want to know what the risk factors are.
Right.
You know, what are the big things that are going to affect my health? And the questions that I end up asking them, a lot of them are just kind of general, you know what you're supposed to do to take care of yourself.
Right.
Are you watching your diet? Are you staying active? But you know, checking people's blood pressure is important, keeping an eye on that every couple of years, even from when you're 18 years old.
So really we should start this habit very young.
Yes, yeah. They say 18 is about when you want to start, you know, have that first blood pressure check. And if it's normal, obviously you can wait several years in between getting it checked again, and you know, maybe get an initial cholesterol check to see where you stand there.
So you can kind of, maybe at a young age, you can kind of set that, that line and then know where you're moving away from that line.
Right. And if you're low risk, you can wait again until you're 40, you know, and get that checked again and see what your cholesterol looks like, and blood pressure and blood sugar.
Right.
And
Let's take a step back just for a moment.
Sure.
Colon cancer screening, which is another thing that for a lot of men is something they're urged to do but may not do, may hesitate.
Right. Yeah, no one's excited about colon cancer screening.
All right.
You know, the colonoscopy has been kind of the gold standard because you can have the screening exam done, and if they find something, then they can take a biopsy, or they can, you know, completely remove it.
Right.
But you know, there's risks associated with having a colonoscopy, bleeding and perforation and infection.
Why do you think men hesitate? Why are men unlikely to come and see a doctor and say, even if they don't have an issue, and say, you know, I just want to check things out, see where I'm at? Yeah. Why do we hesitate?
I think there's a lot of, if it ain't broke, don't fix it. So they want to wait until they're having symptoms before something happens.
Right.
And then it's my job to remind them, if you wait until you're having symptoms, you're probably too late. You know, there's already something going on, and you know, maybe more advanced than just a simple screening test can take care of.
And if you had gone in without the symptoms, you may have avoided an awful lot of problems.
Exactly, exactly.
Well, any month is a great month to talk to the doctors at Kingsville Medical Clinic, part of the Cass Regional Medical Group, but this month for men in particular, it is Men's Health Month. 816-597-3500, and you can learn more about it by calling that Kingsville Medical Clinic. Thank you, doctor.
You're welcome.
Does this count? Did I have a visit? Is this a doctor visit?
I'll have to take a look at your insurance information.
All right. See, I thought I was getting by with something. Michelle.